there of providing general footage of during surgery and of patients and people moving, as well as some animations that provided insight into how exactly their technology addressed the problem. So there are multiple ways that you can approach this, but let's take a look at the winning video for MedTech Innovator Asia Pacific in 2025.
Every year, millions of patients face the challenge of a head and neck surgery, but we dare to change that. Introducing the TORS Transoral Robotic Surgery System, a breakthrough designed to reach the deepest and the narrowest regions of head and neck, with ultra-precise 1mm instrument and 120-degree flexible articulation, even enabling remote surgery from 5,000 kilometers away. We're rewriting the limits of a surgical possibility. Utilizing robotics and AI, we're transforming the future of life and health. From laryngopharynx, oral cavity and maxillofacial regions to the entire head and neck, we're conquering the toughest surgical frontiers. TORS, restoring hope, redefine life.
Great job, Yao, and we'll have the opportunity to speak with him in just a moment. So again, a bit of a different approach, but an excellent combination of having the speaker talk directly to the camera and providing animations that showed exactly what this particular solution can do. So let me just see. Hi, Bernice. I'm currently having my entire screen locked. There we go. Okay, good. I am back. All right. Bernice, you can share your screen again. And we will momentarily welcome Yao Li to join us for our fireside chat. So this was part of the Video Competition 2025. For those of you, some of you may already have discovered this, but you will see that the playlists, the complete playlists of all past 1-minute videos can actually be viewed by anyone on our YouTube channel. So if you want to get some inspiration, take a look at some of the other videos that have been produced over the years, and you'll see what works and maybe what doesn't work quite so well. So with that, let me welcome Dr. Yao Li, and we'll talk briefly about his approach to his 1-minute video. And first of all, obviously, would like to learn a little bit more about Borns Medical. So do we have Dr. Yao Li here?
Yes, I'm here.
Welcome. So maybe, Bernice, if you could put us in gallery mode. There we go. Excellent. Great to have you join us. I believe you are dialing in from Chengdu.
Yes.
Is that right? Okay.
Yes.
Excellent. Yeah. So maybe before we talk about technicalities about the video, great to see you again, and thanks for joining us, Yao. Tell us a little bit about yourself, your background, what your company does, and your role in the company.
Thanks, Frederick. It's my honor to be here, and I was quite happy to see my video again and see all the alumni and the fellows, and of course the new friends online. I'm extremely happy that I participate this competition. I don't want to say competition, but it's a wonderful program from last year, 2025, and I have to say the best video program is the most different and also the most interesting part. There is no any other program will have the best video competition. So I think this is a wonderful opportunity for everyone. Regarding myself, I I originally from China. I spent 15 years in US and I started my company in China back to 2016. So for the past 10 years, we're trying to develop the robotic kit technology to do surgery, including the minimal invasive surgery, transoral surgery, and microsurgery. We want to have a unified platform to provide technology that accessible and affordable to all the hospital and all the patients in the world. So as you can see the video, we try to use a plain and a easy way to present the technology because the audience is very different, but the core is the same. We want to help the people. So I think that's a quick introduction of myself. And back to you, Frederick,
Yeah,
if
thanks,
anyone want to
Jan.
have a questions.
Yeah, we'll come to Q&A here towards the end. Thank you for that short introduction. And certainly, I mean, there are many aspects of that video that I think the audience liked, and one of the reasons that you won, the way that you presented yourself in combination with some of the animation sequences that you had as well. What do you think made your video stand out? Yeah.
Um, I think I present the video by myself, as you can see at the beginning. So I want to tell everyone how we want to do this and why we want to do this. And of course, what is the benefit and what is the future of the technology. I think these are the key element for the video. 60 second is very limited. I
Mm.
still remember Paul asked me the same question when I received the award. You only have a 60 second. Probably you have a 10-year story behind it. So how you want to condense and compress them. So I think if I can tell everyone by myself in the way that everybody can understand, that is the easiest way. So I think this is my feeling. There are many different ways to do it. I think this is even shorter than the MTV. So MTV normally have a four minutes, so we only have a 60 second. So get the key element, why you want to do that, how you want to do it, and how you can benefit from it. That's the three element I want to deliver.
Yeah, no, that's a great point. And we looked at three videos here, and the first video and your video, of course, both of them, and the first one was the MedTech Innovator winner in the US, which again started with the founder and the CEO speaking. And I think if you're comfortable with that as a founder and CEO speaking directly to the camera, then that can instill sort of immediate authenticity, confidence, and rapport with the company and with the everything that you stand for as the face of the company. Not everyone is comfortable with that, and that's okay too. So you saw the second video did not have the founder present at all. They had a voiceover. So that's certainly possible. Ultimately, for the companies that are here online, it is your decision. But I think your decision, Yao, to personally present this and open the video made a lot of difference. So let's talk a little bit about how you planned for this. What was your approach to planning the video? Did you start with a script? Did you do this yourself? Did you have someone in your team work on this? What was your approach to get this done?
So we have a lot of discussion with the team how we want to present this. We have a lot of video footage and also a lot of script, um, many proposals. People want to deliver the messaging in a very different way. They want to do a full animation. Someone want to do the live interview with the doctor. Someone want to do a surgery clip. So there are many, many ways that the team. I leave it to the team. They open their minded and they discuss a lot of things. But at the end of the day, we want to answer the same question. You only have a 60 second. What message you want to deliver? You don't want to make a quick commercial. You don't want to make a documentary. You don't want to make a MTV. The only thing you want to do is the key message, you only have a 60 second and you want to finish and everyone can remember it. That is the key. So at the end of the day, we combined a lot of things. You can see some animation for most of the difficult technical part, some of the surgery you explain to the patients, and at the end of the day, you want to explain to everyone, this is a new treatment, this is a new device, this is a new I don't want to say new robot, but this is the whole thing. At the end of the day, you take it home, say, I know this is a new technology. So that's why we have the whole plan. It's about
Yep.
2 months. It's literally take 2 months to get all the final finish. So I think if we upload one day before the deadline.
Okay, okay. And you mentioned you already had some video footage because I
Yes,
think many companies already have video footage in different shapes or forms. Maybe it's a bit fragmented. You have maybe an animation that you use for certain purposes, and you might
right,
have some pay. I like the fact, for example, that you had after the animation, you showed how you did the remote surgery between I think it's Shanghai and Xinjiang province,
right.
5,000 kilometers, and that was, of course, footage of the actual surgery, which was great, and a very impressive point that you made with that. So combining those sorts of that type of footage with animation, I think worked really well in your video. Did you and your team sit down and write a script word by word that this is what you were going to do second for second?
Yes,
You did.
yeah. We write on every sentence we want to say, elaborate and correct and change and revise multiple times.
Yeah,
It's
yeah.
very important. Yeah.
That's a good point. And you also mentioned, should you bring in doctors to speak or should you have patients speak? And I've seen some videos where that's been done very well, but there is a risk to that, and I understand why some startups choose not to do it because, especially a clinician, it's difficult to control the timing of that statement because it may be that they have a really good statement, but it's 20 seconds and it takes up 20 seconds of your 60 seconds. And that's just too much.
Yes.
So to have a sound bite or a video bite that is so short to be useful for a 60-second video from either a patient or a clinician can be really hard. I've seen some companies do it well, but what you don't want probably is to have a clinician, a customer speak for 20, 30 seconds of the entire video length. Tell
Yes.
me, did you work at all with any external professional agency for this? Or was it all done in-house?
Yes. We definitely need a helper from the outsource vendor. They're super good for quick give what we call the quick turnover to you the demo video or give you the sound effects and give you the addition of your idea. You probably need that. But now I think AI can do that much better with all the AI tool. I think this probably you don't need a third party vendor anymore.
Yeah,
It's so fast. It's so easy.
that's a great point. And certainly
Mm.
there's no expectation from Ethic Innovator that anyone goes out and spends $2,000, $3,000, $5,000 to an external vendor for this.
Yeah,
The vast majority of participating startups in this competition do this in-house for a few $100s. And if
yeah,
you already have some video footage, then certainly you can use that. And to your point, yeah, with AI tools and with many of the online video editing tools that are now available, and we've shared some of the links here with a cohort. It's very doable to do this entirely in-house. Um,
yeah, yeah.
Tell me, yeah, what were some of the challenges that you faced, and as you were putting together the video, and how did you overcome those?
I think it's the time.
Mm,
So, the movie industry take years to do a full length movie, but we have a very short time and we keep changing something. And we start to realize the time is very limited. Every time we want to change something, it takes days and probably weeks to get everything rendered, finished. You don't believe that even the music, background music, takes some time to fit in. So plan your time is very important. Budget is one thing, time is even more important. You need to schedule everything, how you want to change it, how many times you want to change it. And, you know, at a certain point, you got to stop.
Mhm. No, absolutely. I think the intent here is not to spend an excessive amount of time on this. Certainly, it is a useful asset, and hopefully, you design it in such a way that it becomes timeless in a sense that you can use it for quite some time and it doesn't get quickly obsolete. But again, the expectation is not here for you to set aside a team of multiple people to work full time on this for 2 months. That's not the purpose of this exercise. So finding ways of doing shortcuts, doing things quickly and easily is probably the way to go.
But I think it's also quite help for the team because during that time, every day we brainstorming. We will not only talk about the video, we think about the entire production line, and this is the driving force for us. You know, we have to make it very fast. We make it better every time we iterate it myself. So it's actually very helpful. It's a fighting a game and make everyone involved. It's a team actually very enjoying this 2 months, very intense time. It's a good thing. I think you feel a lot of pressure, but at the end of the day, it helped everyone.
Yeah, no, I think that's great feedback. Yeah, and I can certainly see how getting team members at different levels may be involved in thinking about the value that your organization brings to patients and and articulating that in a very concise manner for a layperson to understand. It's not something typically that they think about every day. So this might be an opportunity to do that, and it's a good way to foster a bit of teamwork as well, to get a small group of individuals involved in that. Um, how did you balance the storytelling with the technical and the clinical details? How did you decide where you wanted to use technical animation and where you wanted to use some of the surgery footage? How did you arrive at that balance?
Surgery part is most difficult. I think technology part sometimes easy. The animation is very straightforward. Sometimes they have very fancy rendering effect. Surgical part is the most difficult, or medical part. You're trying to explain a very difficult syndrome and a very special surgery. It's very difficult. So we try to avoid that actually. We try to tell the outcome, try to tell who is suffering from this. That is the key because you don't want to put a very bloody face or
Sure.
a surgical sign in front of everyone.
Yeah.
So I think yeah, tell who is suffering this and what is the benefit of your technology. That would be the key.
That's a great point. And questions sometimes that we get about video footage of actual surgeries using your technology. Um, does the hosp What about patient consent? What about uh, do the hospitals typically agree that you take the video in the first place? And do you need consent from the hospital or even from the patient to then
Yeah.
use that video in some of your promotional material? What does that process look like? And I'm guessing it's probably
Yes.
different in China from the US and elsewhere.
Yeah, there are two different consent. For the clinical study, they have the informed consent, and also use the data, we have a different consent. Regarding the video, you cannot disclose any of the patient name, patient's background data, but you can only use the video clip of the surgical scene. That is the part You cannot tell anything about the patient. You can only show this is the surgical, the video or surgical thing of the patient.
Yeah.
You need
But
a lot of paperwork for that.
yeah, no, I would imagine. But even without disclosing the patient identity, when you take video of the surgical procedure itself, I assume you would need to get consent from the hospital or from the chief surgeon to do some of that.
Um, I think you don't want to really involve too much of the surgeon.
Mm,
They're very different. You
yeah.
know, every surgeon is different, and every different surgeon give you every very different opinion. So I think our audience is mainly focused on the patients and the general audience. Let them understand, you know, one day they can be suffer from this.
Mm,
We give them an option. We give them a solution. Surgeon is part of the team. Every surgeon is different.
yeah. Yeah.
You don't want to convince every surgeon. That's impossible. But
Yeah.
you want to tell the audience you offer a solution.
Yeah. Makes sense. Makes sense.
Yeah, right.
Um, any mistakes that you would want to highlight to the cohort companies that are on the call here that they should be mindful of, that they should avoid when planning to put together this 60-second video? Yeah.
Don't try to get perfect at the beginning. It's a lot of work. Don't beat yourself up. Take a couple rounds and you keep refreshing your mind. Save enough time for that. It's actually a wonderful journey. When you're doing this, you keep asking yourself the question, but at the end of the day, you make the video, you truly reflect your heart, truly reflect the technology. Don't try to tell the story at the beginning or make it perfect at the beginning. That's impossible. So that's my very humble and honest
Yeah, I think that's
feedback.
that's good advice. Thanks for that. I of course I was going to ask you, yeah, how did you at Bourne's Medical Robotics, how did you use the video after you produced it beyond
Yeah.
participating in the competition?
Every time we have visitor, we play this for them. Mhm.
You do. Okay, that's good.
Oh
That's
yeah,
good.
yeah, yeah.
That's good.
Everyone.
Um, and was it did you consciously plan the video in such a way that it would not be it would not have too short a shelf life, that you could use it for an extended period of time? Because the challenge often with a video, if you're too product specific, you have a product version 1.0, and then it gets replaced by a product version 2.0, and now you're on product version 5, and every time you need to update your video. Was that something that you took into account, and you designed the video in such a way to avoid that?
Oh yes, indeed. Like I said, we don't really want to focus on the technology. We want to focus who's suffering from this, the general audience. These are the people generally receive the most benefit out of this. So we want to give them the information. No matter is 1.1 or 1.0 or 2.0, the technology is overall is a concept.
Yeah.
But the whole idea is the solution or the treatment for them. They understand if I suffer from the head and neck surgery or head and neck tumor. I remember I saw a video, someone said that there is a robot or a different solution for us. That's it. Yeah,
Yeah,
I
I
think
think
that's
that's really good advice. So ultimately, for those of you now starting to work on this, think of making this video maybe not entirely timeless, but a tool that you can use beyond the next 12, 24 months. So if you can keep it relatively conceptual, um, so that it doesn't get affected by different product iterations and different product designs, that's probably a sensible approach, especially if you're going to invest some time and effort into this. You want to make sure that you can use it over an extended period of time. But great to hear that you've put it to good use, and you're continuing to use it 1 year later. Yeah.
Oh yeah, we use it every day. I mean,
Excellent.
it's a wonderful tool and it's a wonderful introduction to everyone. There are only few investors, few doctors, but there are tons of patients.
Yeah.
That's the general audience we want to focus on.
Yeah.
In another way, investor and the doctors are the same team. We
Yeah.
want to help everyone. So this can keep playing for years. I think that's the message we want to deliver from day one.
Very good. Very good. Very good. I'm conscious of time. I wanted to open to questions from our audience. So for those of you who are here, you are welcome to just raise your virtual hand at the bottom of the screen to ask a question in person, and we'll get you to do that, or you can just use the chat function. Any questions from anyone on the call? Don't be shy.
Yeah, if anyone has a question, you can always email me. I'll be happy to answer email as
I was
well.
going to ask you, that would be
Yeah,
great. You'll be open
yeah.
that we share your
Oh
email
yeah,
with the cohort.
yeah.
You
Yes,
can
definitely.
any of you can
Feel
reach
free.
out to Yao directly for any tips.
Yeah.
I think that would be fantastic. Um, very good. Any questions from the audience? We'll just give everyone the opportunity to either raise their hand or drop a question in the chat.
I think we have a question from Stuart.
Okay.
Um,
Are you able to read it? Because I can't see it here. Let's see.
um,
General question, not video related. Okay. Have you looked at this is a clinical question, yeah. Have you looked at
So, that's a
esophageal
funny.
cancer for your
Yeah,
system?
yeah, yeah.
Very
That's
good.
a good indication.
You should
Yes.
the two of you should speak separately. So
Yeah. Oh
Stuart,
yeah, yeah, yeah.
get in touch
We'll
with
be happy
Yao
to talk about it. Yeah.
and
Esophageal cancer is a very important cancer. We're definitely interested in that.
very good, very good.
Okay. I'm off mute now. Yeah, we'd love to
There we go.
talk. Yep.
Good. Thanks for joining, Stuart. You should definitely have a conversation
Yeah, send
after
me a
this.
message. Yeah, we'll be
Okay.
happy. Yeah.
Very good. Very good. All right. Well, just remaining on topic, I'm glad the two of you got a chance to connect, but any questions related to the video production here? Any questions for Yao related to that? If not, Yao, maybe any final words, any creative ideas or final tips that you might want to share with the group?
Good luck with everyone. It's a wonderful program. And if I can do it again, I will do it again.